This trial, this is the randomized phase 2 trial comparing the second-line liposomal irinotecan plus 5-FU versus 5-FU monotherapy for patients with metastatic biliary tract cancer after progression on standard first-line Gemcis. Although the recent UK ABC06 study showed the clinical benefit of the modified FOLFOX as a second-line therapy compared to the active symptom control, but there was no clinical trial comparing the two active chemotherapy regimens. But this is the first trial comparing with the control arm using the active and the chemotherapy regimen, which is usually used in daily practice setting. So this is a Korean multicenter phase 2b study. The data showed that clear benefit in terms of the blinded independent central review assessed PFS, and the investigator assessed the PFS and overall survival with liposomal irinotecan plus 5-FU compared to the 5-FU monotherapy. And the toxicity profile is quite in line with those which was shown in the prior phase 3 trial for the pancreatic cancer. And then there's the safety profile was well manageable. There's no new safety profile with the liposomal irinotecan. As the liposomal irinotecan is currently approved for the management of the advanced pancreatic cancer, which has failed on the prior gemcitabine-based therapy. So we may use this regimen for patients with metastatic biliary tract cancer. Although this trial is a randomized phase 2b trial, but is a total 174 patients were enrolled. And this is one of the largest clinical trial in the second-line setting. So I believe this trial shows a clear benefit with this regimen for patients with the metastatic biliary tract cancer, and should be regarded as one of the standard second-line chemotherapy options. Based on these trials, I'm wondering is we have any other options options for global phase 3 trials, because this trial was conducted in a single country. So maybe globalization of the fact that we shown in this clinical trial may be limited because practice pattern might be different among the geographic regions. So global phase 3 trial maybe needed for the approval of this agent, this regimen for the biliary tract cancer, but this is not only for based on my decision. Is the other partners should be together. So the next research option is the long-term follow-up of this population to see the long-term outcome of this regimen in our clinical trial population, and to see the potential post-hoc analysis of the genetic aberrations, the impact on the impact of the genetic aberrations on the efficacy of the liposomal irinotecan in the biliary tract cancer. So, although the genetic testing and next-gen genetic testing is not mandatory in this clinical trial, but so many patients underwent the targeted sequencing, so we may see the potential biomarker of the liposomal irinotecan in the biliary tract cancer.